Dr. Smith, tell us about yourself and why did you go into healthcare? What brought you into the chiropractic field?
My name is Tony Smith. I was actually born and raised in the Antelope Valley. I went away to college and then ended up coming back to the Valley to practice. I've been in practice over 32 years now. And kind of an exciting story is that when I went away to college, so I got recruited. I played football and baseball in college, and I got recruited to play football at Humboldt State. And my football coach, his father and brother were chiropractors, and I didn't know anything about chiropractic. I was heading down the either medical or physical therapy field, and then he introduced me to what a chiropractor was. I started researching into it, and it seemed like a real good fit for me. So I actually went into school there after I got my bachelor's. I'm actually a double major. I have a bachelor in biomechanics and also human biology. And then I got my doctorate in chiropractic at Los Angeles College of Chiropractic. When I was getting ready to graduate, my coach's father called me and asked me if I wanted to come back to the Antelope Valley. And at first I was a little hesitant because I thought I made my way to somewhere else. And then I had a unique opportunity to take over his practice and start my business there. And so I had my foot in the door. And because I knew a lot of people in the Antelope Valley, and then I figured it was the best way to give back to my community was to come back and help people, with their challenges and things that I thought I could help them with.
Describe for me your chiropractic schooling and what was something that stuck with you about your program?
So chiropractic school itself starts with undergraduate training and basically like pre-medicine. So I do 4 to 5 years of undergraduate training, and that's where I got my biomechanics and biology degrees. And then chiropractic was another. Actually, I did a 5-year program condensed into 3.5. So I took kind of not necessarily accelerate. I just took a lot of units. I did 28 to 30 units per semester. So I loaded myself up so that I could get out in 3.5 years and get into practice sooner. So I pretty much overloaded myself, and it was challenging, but it was great for me to be able to get out at a young age and start into practice. Something that has stuck with me about the chiropractic program is I found it fascination and exciting to see the human anatomy. And so growing up as an athlete, I was always looking to things to increase performance and to see how I could be better. And so when I got a better understanding of anatomy, then I could actually reflect back into my own sports participations and things like that.
What is your profession?
I am a doctor of chiropractic. I do manipulation of the spine and joints. I also work with the muscles, ligaments, and tendons to increase mobility and range of motion.
What specialized training do you have or want the public to know?
I have an extensive background in sports injury training, and also I do a lot of auto accidents, personal injury incidents.
Where do you practice? What location do you practice at?
So I practice at AVORS Medical Group, which is Antelope Valley Orthopedic and Rehab Specialist in Lancaster, California.
What do you bring into this medical group?
I bring the conservative care approach to help with patients and complement our medical side. So they have a conservative option or alternative.
What services do you offer?
I offer chiropractic care and also rehabilitative care.
Do you specialize in anything?
I feel I have pretty good comprehensive skills in evaluating shoulder and knee injuries for sports injuries and other accidents, and also some of the spinal injuries that occur.
How long are your appointments? What might make you late?
First, my initial appointments range about an hour long, and then follow-ups can run anywhere from 20 to 45 minutes depending on what we're doing with the patient. What might make me late? Maybe if I got a flat tire on my bicycle ride before I come to work, because I do a lot of cycling.
Tell us an interesting thing about your profession.
I think a lot of people don't really know that chiropractic has a pretty extensive healthcare background and schooling. A lot of people think it's a very short program, but it's actually 8 years plus. And we do extensive anatomy, physiology, toxicology. There's a lot of research and then hands-on, and then we do a lot of x-ray evaluation. Our basic undergraduate program is really close to what a medical doctor is, although they go into residency and they have a lot more extensive training in that fact. But our basic training is real similar to what a medical doctor is. And I don't think a lot of people understand that it's that extensive as it is.
Why should one trust you with their care?
I think one, because I've had many years of practice, over 32 years in practice. And two is that I can adjust my care depending on what the patient's needs are. It's not a one-stop shop and we do the same thing, is that we try to evaluate and diagnose what is happening and then give the pertinent care for that situation.
How do you show patients you care for them and that they are not just another patient?
Well, I try to do my best at listening to their complaints and then finding a solution. In a sense, I'm a solution provider. I mean, I try to help them with their challenges and get them back on their feet again and moving and being more active than they were prior to coming to see me.
Do you have a funny story to share about your career?
I don't know that it's necessarily funny, but I find it pretty interesting that kids that I used to treat when I first got into practice, now I'm actually treating their kids. And sometimes I've actually even seen some of their grandkids, which says I've been around a long time. So in a sense, it's a little funny. And also the doctor that I took over for, I've been able to see his family and their kids come through the practice as well. So it's pretty exciting to see that evolution.
How would a patient describe your care?
Hopefully they would describe it well: effective, efficient, comprehensive, and caring. That's what I hope to achieve.
What do you want the public and your patients to know about you as we wrap up?
I try my hardest to provide the best care possible, and I try to lead by example, trying to stay fit and in shape, and so that I can share with patients things that could be beneficial for their longevity and health and well-being.
What do you do for fun?
I actually do a lot of cycling. I race competitively in road bike racing, cycling, and I also do mountain biking. I actually used to race jet skis at the pro level for 10 years. So I try to stay very competitive and active, and that leads me to searching for ways to be more fit and in shape. And I try to transfer what I learned to my patients and share some of that information and knowledge.